Hello everyone. Myself Dr. Priya Reshma Aranha, Associate Professor, Department of Child Health Nursing, Yenepoya Nursing College. In this video, we will learn regarding impact of hospitalization on children and family and role of nurse as well. The learning objectives of this session, the learner will understand the major stresses of hospitalization for children, enlist the factors affecting reaction to hospitalization, understand parents' reaction to child hospitalization and factors affecting the reaction, explain role of family and explain role of nurse in care of child and family during hospitalization. Now, what is the effect of hospitalization on children? So, children are vulnerable. We know that the long-term illness and hospitalization could cause negative impact on children. This could affect the motor, cognitive, emotional and social development of children. The stress of hospitalization also negatively impact the children, and the effect of hospitalization is based on the age and the development of children. It is said that at later ages, the child understand what changes are happening in them and they will be worried. So, that is how the age and development affects the hospitalization. Whereas, the younger children, because they do not have the understanding, only the love, affect and separation from the parent will be affected. Along with the child, the family also suffers, like parents, siblings and other family members because of child's hospitalization. Now, what are the stress of hospitalization or when the children get stressed because of hospitalization? It is said the children have stress before admission, during hospitalization and after discharge as well. When a child is told that the child is getting admitted to the hospital, it causes stress as the child is worried what will happen to the child and how the prognosis will be. For example, if the play is affected or the school is affected. So, the stress comes even before the admission, and during the admission or during the hospitalization, because of the therapeutic treatment, the pain, the pricks and the other hospital procedures can give stress to the children. And after the discharge from the hospital also, child would be stressful because the child's routine will be affected. The child is worried whether the child can carry out the routine activities, the schooling and the play as well. So, all this becomes a crisis for children, and children have less defense mechanism to resolve the crisis that would lead to stress among children, and they find difficulty in coping hospitalization. We can see the major stresses of hospitalization. The four major stresses identified are separation, loss of control, bodily injury and pain. So, let us see these stresses one by one. First is separation. So, here the child gets separated from the mother, rather primary caregiver or the entire family. Middle infancy and children are commonly affected by anacletic depression. Now, anacletic depression is a severe and progressive depression for those who lose their mother and do not get a suitable substitute, especially the children who are admitted in the pediatric intensive care units or a neonatal intensive care unit where the mother or the mother substitute is not along with them 24/7. Those children may be affected by a depression called as anacletic depression, which occurs due to separation. Anacletic depression is divided into three phases. The first one, phase of protest, second, phase of despair or we can say loss of hope, and third one, phase of detachment. We will see these phases one by one. The first phase is the phase of protest. So, during this phase, the child will be protesting or showing some symptoms, or the child is trying to be against something, or child is rejecting or protesting against something. So, later infancy, that is after 6 to 8 months, we can see that child cries or screams during this phase. Child will be searching for parents with their eyes and they avoid or rejects contacts with the strangers. Now, who are these strangers in the hospitals? They could be the healthcare providers, especially the nurses and other healthcare providers in the wards. Then what the toddlers will do, or how the toddlers will undergo this phase of protest? They will exhibit vulnerable attacks, that means physical attacks in the forms of kicks, bites, and they hit or pinches the caregivers who are near them or in their wards, and also they attempt to escape outside or escape from the ward to find their parents. So, this is how the infants and toddlers will react in this phase of protest. So, what about the older children? As we know, the older children understands, so they will not be showing this symptoms or this activity, rather they will be just quiet or they will express their unwillingness towards the hospitalization or the treatment. So, they do not want a particular treatment to be given to them. So, they may verbalize in a angrily way. So, this is what happens in the phase of protest. Next is phase of despair. So, this is also called as loss of hope, where the children will lose their hope. So, they will feel that there is no hope now, they are already into the hospital. So, they will be inactive, not communicating with the family members, does not want to talk with anybody, they look depressed, they look sad, and they does not show any interest in the environment, and they become non-communicative. Simply to say that they are just withdrawn and they do not talk or do not express their concern, the active child becomes very inactive during the phase of despair. Next is the phase of detachment. Now, here by this time the child understands that there is no outgo, the child has to be in the hospital and get the treatment. So, they try to adjust themselves. So, during this phase of detachment, the child will show superficial adjustments to the hospital environment, also try to develop superficial relationship with the healthcare members. Slowly they starts to show the interest in the surroundings. So, who is there around them, maybe the next bed child, their family, and also the healthcare providers. They start to interact with the strangers or familiar caregivers. Now, who are the strangers? As I said earlier, a nurse can be a stranger to them or a caregiver who is there in the wards. So, this phase of detachment usually occur after prolonged separation from the parents. So, next one is loss of control, or what do we understand by loss of control? See, when the children are getting admitted in the hospital, that is a strange environment for them, where there are lot of restrictions for them, maybe restrictions in their physical activity, their routine is affected and the rituals are affected, they cannot behave or they cannot move as they want. So, that is why they feel helpless and they feel like having loss of control. So, this lack of control and coping skills are specially due to the therapeutic management. We cannot just permit the children to move around as they want. In the ward, children also should be following the rules and regulations and guidelines given to the patients. So, they find difficult. Hospital situation will stimulate the child due to its unusual sight, sound, smell, etc. Now, what could be the unusual sights? Maybe a wound dressing at the next bed, or a patient just come and just vomiting at the next bed. What could be the sound? It could be the sound of alarms in the intensive care unit, or in the general ward it could be the talks, it could be the mobile phone rings, etc. And the smell, the ward itself will have a smell which is not pleasing to the children, because the children never had exposed to bad smells. We can understand when a patient is admitted to the hospital, maybe that the medications, the treatment or the body discharge the patient is having, or just a vomitus or a urine or stool that the child is passed in the next bed, that can cause a bad smell. So, these all things like unusual sight, sound, smell could stimulate the children. Next one is bodily injury and pain. We all know when there is a therapeutic treatment going on for the hospitalized child, injury and pain are very common. It could be because of the injections, it could be because of the blood drawn or any other therapeutic procedure. So, how the child reacts to this bodily injury or pain? So, when a child is 0 to 6 months, child could just cry or just show some body movements, that is all. But later when the child is 6 months to 1 year old, the child may show resistance or uncooperativeness towards the procedure. 1 to 3 year old children, they will be showing aggressive behavior. 3 to 5 years, they will have fear of punishment. If they are not taking the particular treatment, they may fear that punishment will be imposed on them. So, they will have fear of punishment. They also have fear of body mutilation, the death or the verbal abuse that can be given to them. Then later when the child becomes 5 to 12 year old, child will have a fear of disability, because after this treatment and getting discharge from the hospital, whether the child is able to have a routine carried out as pre-hospitalization, whether the child is able to go to school or play with the peer or friends. So, they have lot of fear if they may lose their limb or whether they will be able to function. So, this is the fear of disability. Concern for privacy. At this age, children doesn't want to be treated in a open place or in front of others. So, they have a concern for privacy as well, and they will they can have words to describe their pain. So, they may say where it is hurting, how much it is paining them. So, they can describe their pain. And after 12 years when the child becomes adolescent, child have lot of concern about their body image. So, because as the adolescent they love their body and they feel that they have to be in a good body image. The illness or the hospitalization could affect this body image, so they are worried about. They will have lot of questions in mind and they will ask these questions to the healthcare providers, and their concern for privacy is also to be respected. So, this is how the children of different age groups they react to the bodily injury and pain. Now, let us see what are the factors affecting reaction to the hospitalization. So, we have seen the reaction. Now, let us see what are the factors. So, first one is the developmental age. So, as you know, an infant or a toddler, okay, they do not have much understanding about the therapeutic treatment. So, they may just react in crying or aggressive behavior, and then a caregiver is there to take care of them. They will obey or they will cooperate for the therapeutic treatment. Whereas a schooler or an adolescent, where they have a detailed understanding of what is happening to them, what is the disease condition, and they will have lot of questions. This is because of their development age. So, age becomes a important factor. Second one is the previous experience with the illness. Suppose they had a illness earlier, they had a earlier hospitalization, so they know the routine, so their adjustment will be better. Third factor is separation. So, here separation from the parents. Again here we can say the child, infants and the toddlers, okay, they will have more problem getting separated from the mother or the primary caregiver, whereas the older children may easily get separated from the parents. Next one is the coping skills. So, how the child copes with the stressful condition or the crisis of hospitalization. The coping skills among children could be innate or acquired by birth or what they have learnt, and it varies from child to child irrespective of the gender and the age. So, that is why the nurses, when we provide care to the children, we must understand the coping skills, and we cannot treat two children in the same way. Next factor is seriousness of illness. If it is a acute illness or a chronic illness, that matters. So, child just come for a acute illness, it will be settled in few days or so. So, the reaction will be less, whereas the child suffering from a chronic illness, the child will, the reaction would be severe. And the support system available, support system in terms of parents, the family and the relatives, as well as the financial support what they have, whether the child could get the best treatment and best facilities in the hospital. Okay. Now, how the parents react to their child's hospitalization? During the hospitalization, parent-child relationship also get affected. So, how this is affected? Now, when a sick child is there, parent will be very much conscious like how the child will be cared for or how the child will be kept in a comfortable position. If the parent give a care to the child, it will cause pain to the child or it may comfort the child. So, that confusion the parent may be having, what to talk to the child, what to explain to the child. So, in this way their relationship getting affected, and the parent cannot be there in the hospital, especially in the intensive care unit 24/7. So, parents also will have this feeling of separation from the child. Initially, the parent will not believe the illness of the child. They just say, no, this cannot happen to my child. So, they will not believe. And during the course of the illness of the child, the parent may get angry due to the illness of the child. Parent may have lot of guilt, maybe because of parents problems the child is suffering. So, the guilt the parent may have. Parent may also have fear, anxiety regarding the prognosis of the disease of the child, and all this may lead to frustration and depression among parents. Now, what are the factors affecting reaction of the parents? First thing is seriousness of the threat to the child, threat to life of the child. If the condition is very severe, whether it is acute or it is life threatening or it is a chronic problem. So, seriousness of the disease matters. Second one, previous experience with illness or hospitalization. So, if the parent has admitted to the hospital or parent was a bystander for the child or some relative. So, parent may have an experience of hospitalization previously. This also matters. The medical procedures involved in diagnosis and treatment. Usually, if it is a high level medical procedure like CT scans or ultrasonography like that, parent may be really worrying as what could be the outcome of the diagnosis and the treatment. Then available support system, including the financial support system, or somebody is there to take care of the family at home. If they have other children, who will take care of them, whether they have a family support. So, these also matters, and personal ego strength of the parents. So, how they react to this situation and how they are able to cope up. Then coping abilities. So, some are good in coping, they are having innate or they have developed the coping abilities, this also matters. Additional stressors in the family system. If any other family member is sick, require any treatment, or there is a old parent, their parent who is old and to be taken care of, what is their financial status. So, this becomes additional stressors to the parents. Cultural and religious beliefs. So, many of the times these parents perceive that child illness is because of any evil spirit or the fault of the parents, for which they become guilty. So, the beliefs what they follow about religion and culture also matters. And communication pattern among family member. If there is an open communication pattern, they can share their difficulties, they can share their concern. But if there is no much communication or good communication among family members, everybody will be just suffering by themselves without expressing their concerns to other family members. Okay. Next is reaction of siblings. Now other children are there in the family. So one of the sibling is getting affected or getting admitted to the hospital. What about other siblings? They may feel alone. They will lose the company of the sibling. At the same time, they may fear what will happen to the sibling. So they will have anxiety and they will have lot of worry also. Usually what happens is the parent will show more attention to the ill child. So who is sick, who is admitted, parents will be always caring for them, and many of the times the other siblings are just left out. This could develop jealousy, guilty, or those other siblings may become angry on the ill child. And many of the times the other siblings will not get proper information about the ill child, what is happening in the hospital. So this lead to lot of curiosity, loss of anxiety among themselves, and there is no one to clarify their doubts. Parents will not be explaining everything as if what is happening to the child in the hospital. So lot of doubts arise in their mind, and they perceive that their parents are treating them differently, because when a child is sick and hospitalized, parents will be providing much care, much comfort, and much of the time is dedicated to the ill child, and the other siblings are just left out. So they feel bad and they think that parents are not treating them with lot of affection. And then they also miss the hospitalized child. They miss the company of the hospitalized child, or what they used to play and have fun. So these things they will be missing. So what is the role of family? When there is a admission or hospitalization of child, so what the family has to do? Family has to come together and family need to support each other. Family gets affected when a child is hospitalized as well. They may feel like loss of parenting, loss of sibling, and their role as offsprings. The parents should provide specialized attention to the sick child and the other siblings also, even other siblings to be taken care and give some attention so that they also feel that they are a family. And family centered care. Now what is the meaning of family centered care? So here when the child is sick and hospitalized, the entire family has to care for the child. Maybe the mother is giving the basic care, maybe the grandmother is there to sit with the child and at least tell some stories, the other siblings to divert the mind, and father is there to provide the financial support, and so on and so forth. So the entire family is involved in the care of the child at home is called as family centered care. Then the other children may regard this as unfair and interpret the parents' attitude towards them as a rejection. I told you, when the parents are giving more love, more care and more attention to the sick child, the other sibling feel that it is a rejection from the parents. So parents should be very careful that other siblings should not get these feelings. At the same time, ill child may also feel jealous because he is sick or she is sick, whereas the other siblings are healthy and they are involved in playing or they are leading a good life. So because of that, jealousy is very common among ill children also. Most of the time the parents will blame the well children. This should not be done, because the parents must understand the interpersonal relationship between the siblings. So how siblings interact with each other. So only if the well children are blamed, okay, these well children will develop a negative attitudes towards the ill child, and they may feel more jealous and more angry towards the ill child. So now we have seen how the parent, children, sibling, they react to the hospitalization. We will see what is nurse's role. So nurse's role starts from pre-hospitalization itself. So when the child's admission is planned in the outpatient department, the nurse should talk to the child, talk to the parent and prepare the child and parents for the hospitalization. Nurse should explain the child and the parents about the severity of the disease condition and how the child is doing, that is the health status of the child. Nurse should educate the parents as well as child regarding hospitalization. Nurse should explain the merits and demerits of the treatment. So, why admission is required, why in the intensive care unit. So, merits and demerits they can nurses can make them understand. The nurse should help the children to develop the coping skills and encourage to build and maintain interpersonal relationship with other children who are admitted to the hospital. So, during the pre-hospitalization itself, the nurse can tell the child or inform the parents that when they go to the wards, they can talk to the other patients, other patient relatives, so that they get an idea or they feel much comfortable in the ward. Now, during hospitalization, when the child is in the hospital, the nurse should assess and monitor the condition of the child, carry out the treatment plan which is prescribed by the pediatrician. The nurse should try to maximize the comfort of the child and provide atraumatic care. Now, what is atraumatic care? We know that during the course of therapeutic treatment, the child will get lot of pain and discomfort. So, as a nurse, we have to try to minimize the trauma or pain, maybe by giving a sedative as prescribed by the doctor, or diverting the patient's mind, or planning some play so that the child diverts from this pain. Then good communication and psychological support. It will help the parents to feel more secure and calm and the child to feel less anxious. Nurse should also assess the behavior of children and their parents, understand the feelings of children and the parents. Then get the informed consent for any procedure or for any surgery. Informed consent is very essential. Therapeutic play plays a major role in the hospitalization of the child. So, wherein the nurse can use the toys, puppets to meet the play needs. And in the hospital, especially in the pediatric care units, there are playrooms available where the nurse can take these children and make them to play and divert themselves. Diversion therapy in the form of drawing pictures, reading books, showing them videos and films, etc. will also help the children. Allow the parents to be with the child round the clock. So, usually in the pediatric care settings, parents are allowed. Sometimes both parents are allowed with the child, but in the intensive care units it becomes difficult, but frequently permissions could be given so that the mother or the father or a primary caregiver comes and visit the sick child. Health education is very important. So, nurse has to give proper health education so that in the hospital how to maintain the health status of the child, and also after the discharge, once they go back home, what they have to do. So, give health education. Therapeutic touch is very important. So, children enjoy this therapeutic touch than just talking to them. When you as a nurse, you approach them for any procedure or any communication, always touch them gently, maybe just pat their shoulders or hold their hands. The children will feel comforted. Then provide individualized care to the children. I said previously, we cannot treat two children in the same way. They may be having same disease, they are of same age and the same gender, but their coping abilities differs. So, as nurses we have to understand that and provide individualized care to the children. Need based care. Now, this specially implies to the neonatal intensive care units. Unnecessarily we should not go and touch these neonates, which could lead to infection. So, nurse has to be very careful when there is a need to go and touch or to provide care, especially in the intensive care unit. And nurses should remember to give comprehensive nursing care. It is not only the physical, it is the physical, mental, psychosocial, spiritual, thus it becomes comprehensive nursing care. always promote the growth and development of the children. Then care and support to the entire family. Nurse can encourage the parents' participation in the care of their child and the activities. So, family centered care, what I was mentioning in the earlier slides, the nurse should encourage family centered care. Nurses must be receptive to the loneliness and fear of the child who is unable to understand the aspect of the care. Many of the times the child may feel lonely or the child have fear. So, nurses should be very receptive to these feelings of the child and react accordingly. And it is very important to plan for the discharge. Give discharge instructions as how to take care of the child at home, maybe the medications or exercise, diet, when to come for follow-up, and any other important instructions can be given during discharge of the child. Now, nurse's responsibility in pediatric care setting is not only to care for the children, but the entire family. So, the nurse need to assess and care for the entire family. So, what the nurse need to assess? Assess for the seriousness of child's illness, family's previous experience, medical procedures involved in, and need for home care. Accordingly, nurse has to care for the family. Then nurse should encourage the family for rooming in. Now, what is the meaning of rooming in? For a baby or a neonate, rooming in means keeping the mother and child together in the same room. So, when there is a sick child at home, okay, one of the parent should be there along with the child in the room all the time. So, that is the meaning of rooming in. We must encourage positive attitude among the family, include them in the child care, and also respect the wishes or values of the family. Nurses need to support the family based on verbal or non-verbal messages. Sometimes the family may not verbalize their concern, but nurses must identify the non-verbal clues or messages they are giving and support them accordingly. Next one is to provide information about the disease condition, treatment, how the child or siblings react, and how to manage them. So, to summarize, in this video we have studied regarding major stressors of hospitalization, factors affecting reaction to hospitalization among children, parents' reaction to child hospitalization and factors affecting the reaction, role of family, and nurse's role in care of child and family during the hospitalization. So, to conclude, hospitalization would have a negative impact on child and the family. Role of parent and family is to support the child, and the nurse must educate the parents and family how to involve in care of children and how to support them. And role of pediatric nurse is very crucial to help children cope with hospitalization. Thank you.